Sudden cardiac arrest accounts for nearly 5,000 deaths in the U.S. each and every year. Hard to believe. WNCN's medical expert and author, Dr. Kevin Campbell, joins us with more on the condition and a crucial piece of equipment that could save more lives. Good morning to you, Dr. Campbell.
Good morning.
So let's talk about these life-saving devices. What are they?
So when you are at risk for sudden cardiac death, one of the things that can happen is that your heart goes into a dangerous heart rhythm called ventricular fibrillation.
Okay.
The only treatment for that is an electrical shock, like you see on the emergency room with an external defibrillator. Well, in patients who are at risk, we now have technology that I'll show you here called a life vest. And this is a vest that can be worn on the patient, fitted to the patient, and deliver a life-saving shock in case they need it. This vest is important because when patients get this diagnosis, we need to treat them with medicines before we use more definitive therapy, and this is a nice bridge.
So let me ask you this, because doctor, you make your living off of implanting this little thing right here. I want to show our viewers at home. So why wouldn't they immediately have this, this surgery to have this placed inside their heart?
So this is an implantable cardioverter defibrillator, or ICD.
Okay.
And we implant these in patients as a permanent device to permanently prevent sudden death and lower risk of death by 30%. So the reason we don't immediately implant it is some of these weakened heart conditions get better if we treat them with medicines. So we don't want to just initially implant a defibrillator. And this life vest that we showed is an important bridge and allows us to let the patient try to get better but not put them at risk for sudden death.
Okay, so who makes a good candidate for wearing something like this, the vest that you just showed us?
So, you know, we've all heard that story about the young woman in Fayetteville who was recently diagnosed with a weakened heart. She was sent home with a life vest because it was a new diagnosis, and it saved her life. It shocked her. And then she was able to get a defibrillator after that shock that saved her life. So I think people that are good candidates are new diagnoses of weakened hearts that put them at risk for dangerous heart rhythms, or people who aren't quite sure about whether or not they want to go through the surgery, and it's a good time to think but not be at risk.
Yeah, so tell us, doctor, and this is my last question, for someone who has received a new diagnosis, what is the next step after they've received either the vest or they're signed up for surgery to have that surgery? What happens next? What are some good things to keep in mind?
So the good thing to keep in mind is by putting this defibrillator in, I mean, it's the best part of my job, I get to reduce your risk of death by 30%. So when a patient is going to get one of these ICDs, talk with your doctor, understand what this means for your life, because it does change your life a bit. Make sure your family understands the defibrillator, and be happy about it, because it's like I tell patients, it's your second birthday when we put a defibrillator in, because we're going to save your life.
And if you're noticing anything different, if you're experiencing some symptoms, always contact your medical professional, your doctor, and be checked out. Dr. Campbell, thank you so much.
Thank you very much.
Okay, if you have a question for Dr. Campbell, you can ask him. It's easy to do. Log on to our website at WNCN.com, search links that we mentioned, and from there you can find Dr. Campbell's website. You can also like his Facebook page, which I have done, as well as follow him on Twitter.